In-depth examination of marijuana's negative effects. 1. Increased risk of psychosis EA. Linked to psychotic disorders research, including a large 2019 study in the Lancet Psychiatry, has confirmed a strong association between frequent marijuana use, particularly high-potency strains, and the development of psychotic disorders. Regular users, especially those under 25, are at a higher risk of developing schizophrenia, as marijuana use interferes with brain development and dopamine regulation. B. Genetic predisposition. Individuals with a family history of schizophrenia or psychosis are particularly vulnerable. THC, the psychoactive compound in marijuana, is believed to amplify pre-existing susceptibilities by triggering imbalances in brain chemistry. C. Real-world example. In states like Colorado, psychiatrists have reported a rise in patients admitted for cannabis-induced psychosis. Symptoms include hallucinations, delusions, and paranoia, often requiring hospitalization and long-term treatment. 2. Anxiety and depression. Short-term versus long-term effects. While marijuana can provide temporary relaxation or euphoria, long-term use is linked to higher rates of anxiety and depression. This is due to its impact on the brain's serotonin and endocannabinoid systems. B. Increased dependence on THC. Chronic users may develop tolerance, requiring higher doses to achieve the same effect, leading to cycles of dependency and worsening mental health when not using marijuana. C. Scientific findings. A study in JAMA Psychiatry found that regular marijuana users were significantly more likely to report symptoms of depression and anxiety than non-users. Additionally, withdrawal symptoms, such as irritability and insomnia, often mimic anxiety disorders. 3. Cannabis use disorder, CUD-A, prevalence. NIDA estimates that 10% of marijuana users develop CUD, a condition characterized by dependence on marijuana despite negative consequences. B. Adolescents at greater risk. Teens are particularly vulnerable due to ongoing brain development. Early exposure to THC increases the likelihood of addiction and long-term cognitive impairments. C. Social and economic impact. Individuals with CUD may experience difficulties maintaining relationships, holding jobs, or completing education, leading to broader societal costs. 4. Respiratory problems. A. Smoking and vaping risks. Marijuana smoke contains ammonia, hydrogen cyanide, and other toxins similar to tobacco smoke. Chronic users often develop respiratory conditions like bronchitis, chronic cough, and lung inflammation. B. Vaping concerns. Vaping THC oils has become popular, but poses unique risks, including chemical-induced lung damage. The 2019 outbreak of vaping-related illnesses highlighted how unregulated products can lead to severe lung injuries. C. Study findings. The American Thoracic Society found that regular marijuana smokers were more likely to report respiratory issues, even compared to cigarette smokers. 5. Accidental overdoses, EA. Edible consumption. Edibles, often marketed as candies or snacks, pose a significant risk of overconsumption due to delayed onset of effects. This can lead to acute THC toxicity, with symptoms such as extreme paranoia, rapid heart rate, and psychosis. B. Child exposure. In states like Washington, ER visits for children accidentally ingesting marijuana edibles have tripled since legalization. Pediatric poisonings often result in hospitalizations. C. Overdose cases. A notable case in Colorado involved a college student who consumed a high-dose edible, resulting in a psychotic episode and accidental death. 6. Impact on cardiovascular health. A. Heart rate and blood pressure. THC causes a temporary increase in heart rate and blood pressure, which can be dangerous for individuals with underlying heart conditions. B. Heart attacks in young adult studies in the Journal of the American Heart Association report cases of heart attacks and arrhythmias in young adults shortly after marijuana use, even in those with no prior history of heart disease. C. Stroke risks. Marijuana has been linked to increased stroke risks, particularly among individuals who combine it with other substances like tobacco or alcohol. 7. Increase in traffic accidents. A. Impaired driving. Marijuana impairs motor skills, reaction time, and decision making. A 2018 study from the Highway Safety Institute reported that states with legalized marijuana experienced a 6% increase in traffic accidents. B. Difficulty in detection. Unlike alcohol, THC does not have a direct correlation between levels in the bloodstream and impairment, making roadside testing challenging for law enforcement. C. Real-world data. In Colorado, marijuana-related traffic fatalities rose by 138% between 2013 and 2018, making it a growing concern for public safety. 8. Youth accessibility and usage. A. Increased normalization. Legalization often reduces the perceived risk of marijuana among teens. According to the National Survey on Drug Use and